This video will explain how to check the volume of a balloon gastrostomy tube or button tube, i.e. a mini button or Mickey button, or a transgastric jejunal tube, i.e. a Mick transgastric jejunal tube, a low profile Mick transgastric jejunal tube, or a G-jet transgastric jejunal tube. The water in the balloon that holds a balloon tube in place should be checked every week. Please note that the balloon valve on a button tube or in a transgastric jejunal tube is on the side of the button. You will need the following equipment: 2 5 or 10 ml low slip syringes. If you are a patient at home, these will be delivered via Nutricia. You will also need 1 5 ml or 10 ml water for injection in a plastic ampule. These for patients at home are prescribed via the GP. Wash your hands for 20 seconds. You should also wear gloves and an apron if you're in a clinical setting. If you are checking the balloon volume for someone else, you will need to explain the procedure and gain consent from the patient, or perform the procedure in the patient's best interests. Check the expiry date on the water for injection and syringes. Draw up the recommended volume of water for injection into one of the syringes and open the other 5 ml syringe so it is ready for use. Please note that the volume of water needed will usually be printed on the balloon valve. Slide the external disc 2 to 3 centimetres away from the skin surface unless the tube is a button tube. Clean and dry the stoma site and the tube if needed. Push the tube in 2 to 3 centimetres until the disc is against the skin, and remember you won't be able to do this if the tube is a button type tube. Secure the disc or button against the skin by holding with fingers or use tape. Check the balloon port valve is clean and not broken. Attach the empty 5 or 10 ml syringe to the balloon port. Push it in firmly and give a slight twist to the right. Gently draw back the plunger on the syringe until no further fluid can be withdrawn from the balloon. Check the colour and volume of water withdrawn from the balloon port and discard the syringe and fluid. But please note it is usual for the balloon to have lost up to 1 ml of water per week. Re-inflate the balloon by attaching the second syringe, the one filled with the required amount of water for injection, to the balloon port, pushed in firmly and given a slight twist to the right. Then re-inflate the balloon before removing and discarding the syringe. Please note, you will need to keep your thumb on the plunger of the syringe as you twist it out so that the water doesn't come back up the syringe. Gently pull back the tube until slight resistance is felt. Replace the external disc to ensure it lies at approximately 2 millimetres from the skin surface but isn't too tight or too loose. Please call the Gloucestershire Home Enteral Feeding Team, GP surgery or community children's nursing team if there is more than 1 ml of water lost from the balloon or you have any other problems during this procedure. Thank you.